This surgical procedure, it takes about an hour to do, or maybe an hour and a half, but it involves half time for each ear. Following the local anesthetic, we do correct the prominent ears by approaching the ear from the back of the ear with no scars seen in the front of the ear. The expectation is the time for recovery. Usually leave the sutures, which is the back of the ear, for a week to 10 days. The head is covered with a head bandage for 10 days, and he or she would be seen, again the person is seen by my nurse, a specialist nurse, who would then take the stitches off in a week's time. But I do advise my patients to wear a headband for the next 4 to 6 weeks in order to prevent the curling of their ears while they are asleep, because sometimes it could be very painful. What I always say to my patients is they should refrain from contact sports for at least 8 weeks, because the ears are very tender. Secondly is also to cover the ears with the sports band or a cap, to prevent the cold air rushing into the ears, which may be very painful for the sensitive ears. The scars behind the ears do heal very well, except for a few situations where we always advise the people, if they notice any lumpy scars, to let us know early, so there are various ways of treating them. Otherwise, we advise them to massage the scars from 6 weeks on with moisturizing cream and help them to soften it. The results usually are assessed about 6 to 8 weeks' time, and the patient can return to work within 2 to 3 weeks. The total recovery usually takes about 4 to 6 weeks, and if there are any situations where there risk complications develop, we treat them early and make sure they get the expected results. Following the surgical procedure, all patients go home with their minimal medications, which include analgesics in the form of painkillers. And rarely do we advise them to go on antibiotics for a week. But the usual practice is they get some painkillers which they have to take regularly in order to prevent any further pain. Rarely do we see problems like pressure ulcers or bleeding or hematoma, which is collection of blood within the surgical area, where they would require a small drainage and some further follow-up. The normal procedure is for them to have analgesia for at least for a week post-op. Prominent ear correction depends on the deformity that we see, and every individual is unique in presentation. The presentation could be just prominence of the upper pole of the ear, or a presentation with a large ears, or presenting with a large ear lobes. They all carry different procedures to correct this deformity. But it all depends on what the expectation of the patient is looking for. The aim of the procedure is to achieve a realistic expectation. And patient has to be explained that we can only correct the deformity to an extent. We cannot reduce the large size of the ears. All the surgery involves all the surgical procedure involves is pinning back and reconstructing the folds of the ear. In a very minor cases, we do correct the oversized ear lobes, but it's quite difficult to reduce the large size of the ear without having major surgery. Large amount of patients expect only the ears to be pinned back so that they don't look prominent. And there is an illusion where the ears appear large when they're prominent. The moment they're pinned back, they reduce in size. So patients go home happy. These are the few issues where, again, the procedure is based on what the patient's expectations are. And we try to make them understand and give them the realistic outcomes that can be achieved for a particular case. Also, we do warn the patients that not any two ears have the same size and shape, no two eyes look alike. So we always warn them of symmetry. We do say that we would be able to pin the ears back, but we would not assure or guarantee that the ears would look similar, but they would certainly be pinned back.